Just a quick question. How many of you guys are on Medicaid or Medicare? You might want to watch this. Subscribe, follow, like, and share, comment below. The Unfiltered Veteran. I got your six.
Okay, so I'm at work and I am a health insurance broker. I mostly help Medicare clients or those who have dual, so you have Medicare and Medicaid, or you just have traditional Medicare. Just this week, mind you, we just started August. I've had 5 clients already contact me back to back about losing Medicaid. Mind you, since I'm contracted and licensed in 50 states, I'm talking to different people in different states, and their Medicaid is getting cut off, like literally on the first. One key note that a lot of people probably don't know now is instead of the renewals being every 12 months, it's now changed to every 6 months. On top of that, a lot of people are getting letters sent out to them. Letters are not showing up in the mailbox. And if you get the letter in the mail, it's not telling you the reason why you're losing Medicaid, or if it does tell you the reason why you're losing Medicaid, it didn't even give you a chance to be able to fucking figure it out. Now, if you have a Medicare Advantage plan and it's a dual plan where your Medicaid and Medicare work together, contact your insurance company if they haven't contacted you first and verify and confirm with them if you're able to have a grace period. Because most insurance companies, I know Humana, Aetna, and sometimes even United Healthcare gives you a 6-month grace period to be able to figure out what's going on with your Medicaid, because whenever you lose Medicaid, sometimes it does take a while to get it back. Most cases, especially like recently in Florida, I can say, they've been getting Medicaid like probably within the next month. Another thing that people don't realize is Medicaid is different in every single state. So if you move out of your home state to a different state, you have to premeditate your Medicaid benefits before you actually fucking leave. People will move and then they'll try to figure out their Medicaid while they're in that state, not knowing that it's a longer process to transfer your Medicaid over to that state. And then the income requirements are different. So you could have full Medicaid in your state, you move to a different state, your income is way higher than what you had before, or whatever the case may be, and now you only have partial. It's a case by case type of thing, but I urge anybody who does have state Medicaid assistance to check your portal every freaking day now, because even though the bill got passed and a lot of people are saying it's not going to start until 2026, it's a domino effect. Some will be affected now this year, and some people won't be affected until next year. You just don't fucking know. And because nobody knows anything anymore, you want to be on your shit all the fucking time. If you have a health insurance advocator or an agent or anything like that, talk to them. Review your plan, review your coverage, because shit is getting wicked. Another thing about whether you have Medicare or you're aging into Medicare and you receive Social Security, the Part B premium payments for your Medicare Part B premiums this year is $185. Last year it was like $174. We just recently got an update. Projected increases for the Part B premiums are going to be hitting close to $200 to $206 now. Prepare yourself, if you have Medicare or going into Medicare, to have all of your ducks in a row. This year, shit is getting wicked.
Big beautiful bill. So for all y'all said that the changes to the Medicaid program were only for the able-bodied people, we just got to get these people to work. You said it was not going to impact the disabled or the elderly. Yeah, I invite you to scroll your TikTok timeline today and see all the families that got notices that said that they have to get their parents and their elderly people and disabled people out the nursing home, because the nursing home is no longer going to be accepting Medicaid. Now you tell me what's going to happen to these people. There's already a shortage of beds when it comes to this population anyway. So where they going to go? Home with the family? Families aren't trained in this type of care. They can't afford to have nurses to come in. If they could, they wouldn't have their people in a nursing home, right? A process of elimination. No pun intended. Tell me what's going to happen to these people. Because your administration doesn't want Medicaid. And what's sad is that this is just a precursor to the impact of the big bad bill. Yeah. Y'all voted for that.
Please explain it to me. The man in charge of the economy's got 6 bankruptcies. Asking ChatGPT to define GDP, defunding education when half the country can't read. Well, now it's clicking for me.